Welcome to this third video on the Semmelweis story. Semmelweis's work was undoubtedly an important contribution to modern medicine. In this video, I ask a different hypothetical question. Given Semmelweis's clear concern for his patients and the abundant evidence that there was a persistent problem, why didn't he close or attempt to close down the ward that had a higher mortality rate and thereby save lives? After all, the notion of doing no harm, implied by the Hippocratic oath, was known to have been accepted by physicians in those times. The simple answer is that he was not in a position to do so, and the climate of his times certainly ran against such a decision. However, if we examine these answers in more depth, we will see that his response to the need for balancing science with ethics was a reflection of the complex social and scientific context of his time. And this is a pattern that has continued to the present day. The Vienna General Hospital, like other city hospitals, had been established in the humanitarian spirit of the Enlightenment. The maternity ward helped hundreds of poor women to deliver their babies, in exchange for their being used in the training of obstetricians and midwives. Viewed in a different light, this provided medical science with an extensive supply of disposable bodies, both living and dead. Unfortunately, the Enlightenment's scientific bias encouraged doctors to view the body as a mechanism and tended to downplay the human element. This could be seen from the 1747 book, Man as Machine. The Enlightenment also encouraged a new approach to ethics. In 1780, the British philosopher Jeremy Bentham expounded his principle of utilitarianism. One implication of this principle was that the outcome of an action was more important than the original action. This has been called consequentialism. Consequentialism implied that experimentation on individuals was acceptable, as long as its possible results could be seen as being beneficial to other individuals. A potentially positive future outcome determined the appropriateness of the actions. By contrast, the Hippocratic approach insisted on allowing no harm to the patient under care. The physician would be relying on past experience, and any new discoveries would be accidental. This is known as the deontological approach, or the notion of ethics as duty. Consequentialism stood in opposition to Hippocratic deontology, which demanded that the doctor devote himself to the patient in his immediate care. The groundwork for Semmelweis's investigations was already set up for him before he arrived. Let us go back in time and understand what led up to this situation. Semmelweis's superior was Professor Johann Klein. Klein's predecessor was Johann Lucas Bohr. Born in Bavaria, he moved to Vienna, where he finished his studies and began his work in obstetrics. He impressed Emperor Joseph II, who encouraged him to visit Holland, England, France and Italy to augment his medical experience. On his return in 1789, he was named director of the Vienna General Hospital's maternity ward. Following his mentor Anton Rechberger, Bohr advocated a conservative approach to obstetrics, discouraging intervention with instruments and advocating natural parturition. He held his post at the maternity ward until 1822, when he was forced to resign. His successor was Johann Klein, who supported anatomical pathology. Since the beginning of the 19th century, anatomical pathology was seen as the new hallmark of science, and doctors were encouraged to take a more active scientific approach to their patients. As most diseases were characterized by visible signs and symptoms, it was thought that performing an autopsy would help to clearly characterize all diseases and become an aid to diagnosis. The British obstetrician Robert Gooch gave the following advice: "Make yourself perfect in the art of examining dead bodies. Accustom your hands to open them and your eye to detect with accuracy morbid appearances." This movement was strongly underpinned by the activities of Karl von Rokitansky, who changed pathology from a descriptive activity to becoming a basis for diagnosis. He went so far as to perform an autopsy on Ludwig van Beethoven to try to explain the cause of his deafness. Rokitansky was appointed as the first chair for pathological anatomy at the Vienna General Hospital in 1844, and later served as dean of the medical faculty. From Klein's tenure onwards, anatomical pathology was inextricably intertwined with the maternity ward. Under Klein, the lying-in hospital became so overcrowded that an extension was built in 1833, and 2 clinics were created. Originally, both clinics were used for teaching medical students and midwives. In 1839, it was decreed that the first clinic would be used for teaching medical students only, and the second clinic for training midwives. Although Klein's students would spend much time examining patients who had succumbed in the first clinic, there were complaints about the low level of his publications. It was also said that he felt threatened by the doctors who worked under him, and he was criticized as being an insignificant doctor who owed his position more to his personality than to his abilities. Semmelweis, on the other hand, was a difficult and dogmatic man who was intolerant of criticism. It was under Klein that Semmelweis studied and worked, first as a medical student from 1837 to 1844, and finally as an assistant in obstetrics. There is ample evidence that their mutual relationship was poor, and in 1849 Semmelweis's contract was not renewed, forcing him to return to his native Budapest. Although much attention is attached to Semmelweis's record at the hospital, it's worth looking at the hospital's record during the tenure of Klein's predecessor, Johann Bohr. In this graph, we see that the mortality rate during Bohr's tenure was low and comparable to the rate achieved when Semmelweis enforced hand-washing. It was also comparable to that recorded at the Dublin Maternity Hospital during this period. Obstetricians at the Dublin Hospital did not perform autopsies before entering the labour wards and washed their hands between examinations. Professor Bohr, who had been trained in England, refused to use cadavers in his instruction, preferring models. His refusal was regarded as not being in step with the increasing anatomical basis of teaching in Vienna. Klein, on the other hand, was more in tune with current opinion. He disagreed with the idea of contagion and encouraged post-mortem dissection and the study of diseased organs. Both Edward Lumper and Karl Braun opposed Semmelweis's thesis and advocated an epidemic hypothesis, ascribing puerperal fever to a variety of other causes. Karl Braun succeeded Klein as dean of the medical faculty. He became rector of the University of Vienna and was knighted in 1872. Under him, the mortality rate in the maternity ward stayed low, as he apparently maintained the hand disinfection protocols that Semmelweis had advocated. As a result of his observations, Semmelweis insisted that puerperal fever resulted from the transmission of material from cadavers, and that this was the only source of the disease. He did encounter 2 cases of puerperal fever originating from living persons, and this he ascribed to the spread of decaying animal organic matter. Although puerperal fever was associated with the birth process, and anatomical pathology focused on the uterus, this approach was not successful in unraveling this disease for a long time. Puerperal fever left many apparently unrelated lesions, suggesting multiple diseases which defied classification. Real progress on discovering the source of puerperal fever required further evolution in medical research. The first microscope was built in 1590, but it was only in 1675 that Anton von Leeuwenhoek started to use it to first observe insects and then bacteria. Leeuwenhoek recorded and sketched bacteria from the human mouth, but it was only almost 200 years later that it was fully put to use in medicine. One of the reasons may have been the poor quality of the magnification, which was finally improved by achromatic lenses. Rudolf Virchow learned microscopy from the pathologist Robert Florip, and made many important discoveries by studying the cells of human tissue under a microscope. In particular, he developed a systematic form of autopsy based on cellular pathology. He made famous the dictum that all cells come from cells, and he is known as the father of modern microscopic pathology. Virchow was a critic of Rokitansky, and he was responsible for making the Charité Hospital in Berlin a serious competitor to the Vienna General Hospital. Both men also played important political roles. The final piece of the story was the confirmation of germ theory as it is accepted today. We owe this result to the work of Pasteur and Koch. Pasteur needs no introduction. In this context, it is worth mentioning his swan neck flask experiment, which proved that there were microorganisms in the air that provoked contamination. This put an end to the previously held notion of spontaneous generation. His work on pasteurization and vaccination added further evidence. Koch complemented Pasteur's work. He used a microscope to identify bacteria causing tuberculosis and cholera. He developed a set of principles known as Koch's postulates, which laid the foundation for identifying the causative agents of specific diseases. Finally, it was Theodor Billroth who discovered the bacterium causing puerperal fever, identifying it as Streptococcus pyogenes. In the end, the world had to wait for the development of penicillin in the early 19th century before a suitable medical treatment for puerperal fever was established. Returning to the ethical question I posed at the beginning of this video, we can look at how social and scientific aspects of the Enlightenment were gradually compartmentalized, and how medical science at times started to ignore ethics. In the beginning of the 19th century, there was a lack of consistently successful treatments in medicine. This led to certain critics doubting the validity of medical therapy. Some even believed treatment to be detrimental. This movement was known as therapeutic nihilism. Others, like Dr. Bohr, whom I mentioned before, believed in minimal intervention. Here I should add that in rural areas on all continents, greater emphasis was placed on herbal treatment inherited traditionally from elders. Hospitals in cities, on the other hand, generally began to take a more aggressive approach to medical research. By today's standards, Semmelweis's experimental research could be characterized as somewhat passive. Outside of his work in anatomical pathology, he was able to compare various factors in the two clinics with minimal negative intervention on the status quo. In no way could we accuse either Semmelweis or his contemporaries of being unethical in their medical research. Nonetheless, as the appetite for scientific research gained momentum, certain doctors started to take liberties in the name of science. This was particularly relevant for women, who often had little to say in the management of their childbirth. New ideas, new procedures, drugs and therapies required human guinea pigs. For this purpose, doctors started to use patients who were considered to be of a lower social value, ignoring their discomfort and sometimes their potential death. There are a number of examples of this abuse, but I will just focus on some experiments that specifically targeted women. James Marion Sims made multiple contributions to the field of obstetrics. He is mainly well known for developing a surgical technique for repairing fistulas, a common complication of childbirth in his times. He invented the Sims speculum and catheter. He established the first hospital in New York specifically for treating women. Unfortunately, in his experiments, he abused the status of enslaved black women by operating on them without using anesthesia. Later, there would be further abuse of the African American population in the infamous Tuskegee and other experiments. But the most infamous remain the abuses of prisoners in German and Japanese concentration camps during the Second World War. Although Josef Mengele is perhaps the best known of the Nazi doctors carrying out inhumane experiments on prisoners, it was Karl Klauberg who inflicted the worst atrocities on women. Klauberg was handed the challenge by Himmler of performing mass sterilizations as efficiently as possible. His experiments included injecting caustic substances into women's uteruses. Himmler apparently was very satisfied with Klauberg's results. The atrocities performed in Unit 731 by Japanese doctors are perhaps less well known, and unfortunately appear to have been even more inhumane. Worst of all, the main doctors were never punished, while American doctors after the war appeared to be enthusiastic about obtaining and using their results. In both cases, these were highly qualified research scientists who carried out abominable work. We could regard these cases as outliers, tied to the specific conditions of the Second World War. But there is also enough evidence to argue that they were the result of a slippery slope beginning sometime in the 19th century, where the excitement of scientific discovery began to outweigh ethical considerations. To try and deal with the extreme abuse that took place in the Second World War, the Nuremberg Code was set up in 1947. This focused on the human rights of research subjects. It was followed by the Declaration of Helsinki in 1964. This centered on the obligations of medical investigators to their research subjects. The declaration resulted from a greater awareness of how medical research still skirted standards of human decency. This, in turn, was followed by the Belmont Report in 1978, which further addressed ethical issues arising from the conduct of research with human subjects, and spelled out the obligations of research institutions that received federal funds. To go full circle, it reiterates part of the Hippocratic Oath. Even with these restrictions on the practice of research, it's impossible to deny the prestige and power accorded to science in medicine today. When monetary reward is added to the equation, this produces a serious challenge to the original purpose of medicine to care for and to cure the patient. The doctor today is often a star with limited time to grant to each patient, and that often results in less care. Those who care for patients, the new caregivers, are no longer the doctors, but lowly, underpaid medical assistants, often women, sometimes coming from disadvantaged countries. We remember the names of Semmelweis, Virchow, and Rokitansky as important figures in medical science. Why should they be more familiar to us than, say, the names of Johann Bohr, Justina Siegemund, or Sarah Stone, who were less concerned with scientific intervention, but cared enough about their patients to ensure lower rates of mortality? It may sound strange that I have linked Semmelweis to what happened in the Second World War, but the link comes about through the notion of science. Science questions reality through research and experimentation, and because of that we've achieved much progress. At the same time, that shouldn't take away our right to question science. Thank you for watching this video, and I hope you'll join me for other videos in this series.